Wintertime is the season of runny noses, coughs, headaches, flu. It's that time of the year, isn't it?
It sure is.
Influenza season. Let's talk a little bit about ear, nose, and throat issues. We've got Dr. Jered Mancell on the line this morning. Doctor, good morning.
Good morning.
As you see patients at the clinic, what kind of things have you been seeing this winter?
Kind of like you mentioned, increase in sinus disease, increase in ear infections, sore throats, all of the common things that we see throughout the year but are probably more frequent during the winter months.
How do we know, doctor, when we've got a sinus infection or an ear infection that might require a visit to come and see you?
That's a great question. I tell a lot of patients that the vast majority of sinus or ear infections start with a virus, and there are some antiviral medications, but typically we treat those symptomatically and let them run their course, which they resolve in 10 to 14 days typically. When symptoms progress beyond that period of time or appear to improve at some point and then acutely worsen, that's when we start wondering, did it become a bacterial sinus infection or a bacterial ear infection? A lot of the symptoms are the same early on, but that's one of the big differentiators as to when they need to call our office or their family doctor's office and maybe get on some antibiotics.
Why does it seem, doctor, like babies often get ear infections? Why is that?
The younger we are, the smaller the eustachian tubes are, and the eustachian tube is what ventilates the space behind the eardrum. It's an air pocket behind the eardrum that needs fresh air periodically to equalize the pressure. When it doesn't equalize that pressure, it forms a vacuum and it can pull fluid out of the tissue that can then become infected. Babies tend to have smaller eustachian tubes and they're more horizontally oriented. And as we grow, they become more vertical and larger. So we tend to grow out of those issues 5, 6, 7 years of age, but definitely there's still some adults that have problems with that.
When we talk about sinus infections and ear infections, do we typically see an ear infection in one ear? Can we see it in both ears? And similarly, in the sinuses, do we see it in one side of the nose or both sides? How does that work?
It can be, so there's several sinuses. There's cheek sinuses, one on each side, forehead sinuses, one on each side, a labyrinth of what we call ethmoid sinuses on each side. They're more like honeycombs. And then the sphenoid sinuses are in the far back. And yeah, we see a hodgepodge of, it can be just one isolated sinus or all of the above. Most of the time with ears, it's usually one ear infection. But yeah, you can definitely have both. Basically, the lining of the nose, the sinuses, and the ears are all the same tissue. So anything that causes inflammation or congestion of that tissue can lead to infection of the sinuses or ears or nose.
What's the best course of treatment when these folks come in and see you with a sinus infection or an ear infection?
So if it makes sense that it's bacterial at this point, we definitely start them on some antibiotics. Symptomatic relief can include rinsing with saline. I do typically have them start intranasal steroid sprays, which I tell people steroids don't care what the cause of the inflammation is. It just tries to decrease that inflammation, leading to decreased congestion, which can open those areas back up. Unfortunately, the intranasal steroid sprays can take some time. It's not a quick medication, so sometimes we have to do things like oral steroids on top to help decongest early on.
Are there tests that you do that determine whether it's an infection or not? Like, for instance, secretions from the nose or looking in the ear. How do you decide if it's an infection or not and what kind it is?
For the nose, we can actually use an endoscope, a small camera, to enter the nasal passages, and if we can see purulent or pus material draining from the doorways of the sinus into the nose, yeah, we can culture that. There are, the most common bacteria that we typically go after initially, and sometimes we just treat empirically where we know it's one of these top 3 and we're going to cover those with one antibiotic, and if people aren't getting better, then sometimes we do try to go in and get a culture. As far as the ears go, the first thing I try to differentiate is, does it look like pus or does it look like a sterile fluid that kind of normally has an amber hue to it. It's not purulent. It's not full of white blood cells. If we ever make an incision in the eardrum to put a tube in, we can always culture that too. But again, it's typically the same bacteria, and so unless we're at the point of putting tubes in or making an incision in the ear, we're treating that empirically as well.
One of the things that we can buy over the counter, doctor, are these sinus washes, like a neti pot. And I've used those before in the past. Do they serve a purpose? Can they help folks out who are dealing with sinus issues?
Absolutely. I'm a huge advocate of nasal saline rinses in some capacity, anything from pre-mixed bottles to the neti pot to the NeilMed sinus rinse, and now there's a new motor battery-operated one called Navage that actually pumps the saline through the nose. I tell the patients it does take some getting used to if you've never tried it before, but the advantages are they're going to wash away some of the dust, pollen, smoke, perfume, cologne, viruses, bacteria, allergens, and the solution to that pollution is dilution. So if we can get rid of some of that, it has less chance to interact with the nasal lining and cause that irritation. The second benefit is our nose normally makes mucus, which is a moisturizer, but it's also a barrier to some of those medications that we're trying to administer to the nose. So just by rinsing the nose and rinsing some of that mucus away, the medications that we're trying to deliver to the nose have a better chance of obtaining higher concentrations by getting the mucus out of the way.
What about nasal sprays, doctor? And I've had those prescribed to me in the past. It hasn't been a nasal spray that I can buy over the counter, but it's a prescribed nasal spray. If memory serves me correct, it might have had some sort of a steroid in it. What can you tell us about nasal sprays?
There's a handful of different categories, from steroid sprays to antihistamine sprays, and then there's other medications that are geared towards just decreasing a chronic runny nose. Years ago, the steroid sprays were all prescription. Now they're mostly all over the counter. They're readily available to people. The antihistamine sprays are prescription, and then there's another medication called Atrovent nasal spray that we use for people with just a chronic runny nose and postnasal drainage. It seems to work well.
We've talked a lot about the ears and the nose. Let's shift the conversation to the throat. If someone comes in and sees Dr. Mancell and they've just had a persistent cough that just will not go away, maybe you sit them down in the chair and you tell them open wide and say ah, and you're looking in the throat. What are you looking for?
For cough symptoms, if I'm just doing a transoral exam, I'm looking for drainage, postnasal drainage, thick mucousy stuff running down the back of the throat, or what we call red lateral bands, which are irritation of the back of the throat mucosa from mucus or drainage chronically running down. We also have the capability to do a fiber optic nasolaryngoscopy, which is, again, a small camera that we go through the nose. We're able to flex and look downward at the vocal folds, make sure we don't see any anatomical issue, nodules, polyps, lesions, things like that may be causing this cough. We're also looking for evidence of acid reflux, which is a very common cause of persistent cough in patients that we see in the office. Even if it wasn't the initial culprit, a lot of times people get a viral infection, a laryngitis. And like I said, normally the viral issues typically run their course in a week or two. But if it's been going on for multiple weeks or months, sometimes it's those underlying things like acid reflux or postnasal drip that just keep perpetuating the symptoms.
Now, when we talk about the infections involving the ear, the nose, the throat, they're in such close proximity in our body. At what point, doctor, should a patient decide that, okay, I've been dealing with this long enough, it's time to come in and see Dr. Mancell?
Yeah, exactly. When they say when they're finally tired of it and they've been trying things and nothing seems to be resolving. Like I said, there's a large overlap with primary care, so their family doctors are well adept to treat all these things too. So I would say anytime something's just not getting better, they feel like they've tried everything, or if they just want to start with me, that's fine as well too. When somebody gets cold symptoms, I usually tell them wait a week, do the symptomatic therapy, because the vast majority of ear, nose, and throat issues are viral, and there's not much we're going to do early on but if it persists beyond 7 to 10 days, or at some point was getting better and then gets acutely worse again, that's when we're suspicious of a secondary bacterial infection.
Can these infections, are they easily transferable from person to person or not?
It depends. The viral side of things, yes. Respiratory droplets, coughing, not washing your hands. The bacterial infections, not so much, but again, if you're not washing your hands or close contact or exchange of kissing, sharing saliva, those sort of things can swap tonsil infections.
If someone is having ear trouble, for example, they don't know that they have an ear infection, but they just don't feel right, and in their mind they're thinking, like influenza, I just need to let it run its course and it'll go away. Do these infections ever go away on their own?
They can, absolutely. Our bodies, we always think we need antibiotics or some sort of treatment, but we forget our bodies are very well equipped to fight infections as well. I think the majority of the time we just want to get over it sooner. Now, the flip side of things is if we're not clearing that infection, there can be long-term consequences. And they're more rare in this antibiotic era, but there are some things, especially since you mentioned ear infections. Typically, if there's fluid or infection behind the eardrum, it's going to affect hearing. And so a lot of times people say their ears feel plugged, and they assume it's an infection, and they maybe wait for it to clear. But there is an entity called sudden sensorineural hearing loss, which can be caused by a virus, and basically within a couple days they can lose a large amount of their hearing. And that's one thing that we have a small window of time to treat, preferably within 2 weeks, but for sure within a month. The studies haven't shown that starting treatment outside a month is all that beneficial. That's the flip side of things, is if they had a cold, they feel like their hearing's plugged up, it could be a nerve loss on that hearing. I do recommend anytime somebody feels like their hearing changed that they're seen by their primary doctor, myself, or get a hearing test.
That's very interesting. Doctor, I've had sinus issues in the past where there have been instances where my upper cheekbones, they feel like they're almost tender to the touch. Am I imagining that, or is that real?
That's absolutely real. Again, there's a sinus within each of the cheeks, below the eye and above the teeth. And when that lining gets inflamed, it can irritate the sensory nerves that come out just below the eye. It can put pressure on the wall. That's definitely something we hear a lot of people complain about. But the flip side of that is those same cheek sinuses share the floor with the molars of the upper teeth. Mm-hmm. And sometimes dental infections can irritate that same lining and give the same symptoms. So it's one of the things that we work with the dentist on to try to delineate if we think it's a sinus issue or a dental issue.
The camera, doctor, that you put down the nose or down the throat, is there any kind of anesthesia that's done with that, or is the patient awake and conscious when that's being done?
In the office, they're awake. We do use a topical medicine that numbs the tissues of the nose and decongests the nose so that the camera fits easily. Obviously, there's some people with deviated septums that make it a little bit more difficult to navigate that nasal passage. But, yeah, we've scoped 4-year-olds consensually in the office. It's not a big deal.
And when you put that camera down the nose or the throat, do you have the capability of taking pictures then that you can
we do.
Look back on?
We do. We take pictures. We can save them to the chart. If we're following a lesion or something like that, we can compare the pictures. It also helps with, unfortunately, people do develop vocal fold cancers, throat cancers, things like that, and we can save our pictures to the system, and our cancer doctors can access those pictures when they're planning treatment.
Very interesting. Now, your clinic, right now you operate out at Mallard Point, is that right?
That is correct.
But you're going to be moving?
We're going to be moving to the specialty clinic sometime this spring.
And what will that move allow you for? What's the thought process behind that?
I think they're trying to get all the specialists in the same area to make it easier for patients to access. It'll have a more central location within Watertown. My My surgical cases initially were done out here at Mallard Point. We've moved those to the hospital, so I've been operating at the hospital for the past 4 or 5 years now. Just make things a little more convenient for that as well.
Certainly makes sense. If folks think that they need to see Dr. Mancell, if they're having an ear, nose, or throat issue, which is the best way to get a hold of you to set up an appointment and maybe a consultation?
Phone number is 605-882-7740, and the website prairielakes.com.
Just curious, Dr. Mancell, once we get through the winter months and we get into spring and warmer weather returns, do things quiet down a little bit for you or not? Because I'm thinking then we've got grass and we've got trees budding, and then you're maybe dealing with people who have various allergies.
True. It does tend to slow down in the early summer, but you're right. We do see spring allergies, fall allergies, back to school, viruses, things like that. But we also see a lot of other things that aren't necessarily related to allergy as well. So we're fairly busy throughout the year.
Always something to keep the doctor busy, that's for sure. Dr. Mancell, it was good to visit with you. Thank you very much for your time, and we'll chat again down the road, okay?
Thanks, Mike. Have a great day.
You too. That's Dr. Jered Mancell. He is an ear, nose, and throat doctor with Prairie Lakes Healthcare right here in Watertown.